Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast. What's up, Everything Medicare Podcast Nation? This is Christian Brindle. Wherever you are and however you might be listening to me today, thank you so much for taking the time to spend with me. Every single week, we bring you 3 podcast episodes where we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. My name is Christian Brindle. I own a company called Christian Brindle Insurance Services located just outside of Salt Lake City, Utah. And we work with people on their Medicare in 10 states at the moment: Utah, Idaho, Colorado, Washington, Oregon, California, Texas, South Carolina, Virginia, Florida. We work with people abroad, folks, and we partner with all of the largest insurance companies in the industry to help you find the best available fit based on your specific needs and preferences. And as I mentioned a second ago, every single week, me and my organization bring you this podcast 3 times a week, to bring you informative information that you're not going to find anywhere else. We've been doing this a long time. For those of you who don't know my background, I got into this business because my dad, before me, was in the business. And I got in at a very young age. I started working with my dad before I could legally buy alcohol. I could legally buy beer in a bar. And essentially, folks, I fell in love with the business right away because I love working with people. I'm a very big people person, and I don't know. I just have a thing for insurance. I published 3 books on the topic of insurance, 2 about Medicare specifically. Thousands of people have bought my books online. You can find them on Amazon. The one that just recently came out was The Insurance Funnel. 9 simple tests every insurance policy must pass before being worthy of purchase. And that's not just about Medicare. That's about insurance in general. If you're watching this on YouTube, here's the book right here, The Insurance Funnel. But the most popular book I ever put out was Medicare Guidance, Picking the Plan for You, because it basically breaks down Medicare in a nutshell. Very simply, very easily. A chapter about everything you need to know, so you can go pick that one up as well on Amazon. Just type in Christian Brindle, Brindle, and you'll be able to find it. And today, folks, I wanted to talk about a topic that we have discussed before on the show. But I didn't think that we talked about it enough, and I thought it would be a good topic to kind of rewind and kind of come back to. And that is special needs plans. Now, what are special needs plans? Well, let's kind of dissect this a little bit. In our country, in the United States of America, we have all different kinds of assistance for people with low income. Whether you think that's a good thing, whether you think that's a bad thing, or is irrelevant. I'm not going to tell you what I think about it because it doesn't really matter and it doesn't add anything to the conversation. But it's the fact, right? We have, Section A housing. We have, subsidized housing. We have things like food stamps. We have things like Medicaid. And we have all different kinds of things that essentially put us in a position that, people are in low income can be helped out by the government. Hey, Stormy, bring her over here. My wife and daughter just walked in, everybody. I'm going to bring her on, and she's gonna share some insight with us, okay? And I'll come back to this topic in a second. Bring her over here. Who, Violet? Yeah, bring Violet over here. You want to say hi? Here, let me back up.
Gotta hurry, she's due for a nap.
Okay. All right, everybody. I can't resist. I am a total girl dad, and I'm very proud of my little girl. You want to flip her around for me so I can hold her better? Okay, thank you.
Yeah.
Hi, sweetheart. All right, everybody. Violet in the house. Violet is my 11-month-old daughter. She's trying to reach for the microphone. We did this before, where she was my guest speaker. And right now she's scratching the microphone, so if you hear any turbulence, that's basically it. Yeah? What else do you got to say? You got some wicked Medicare knowledge you want to drop on the audience? Yeah? Here, maybe we can get you to talk. Violet's just getting ready to talk. She's learning. She's getting better every day. Here, I'll give her back to you. Just thought you might want to come say hello. Say hi to the audience. But you're scratching up the microphone. The microphone's very expensive, baby.
Oh, Violet. Come here, baby.
Thank you, sweetheart. Okay, everybody. Sorry about that. I don't usually shoot the show from home, but, we're in quarantine, right? I mean, everything that's going on with the coronavirus, we're forced to kind of do everything from home. Usually we're doing the show in the studio, so my daughter doesn't usually get to be on the broadcast as much. Just thought you folks might want to hear a little bit from her. Anyway, folks, back to the topic at hand. In this country, we have assistance for people in so many different areas that are in low-income situations. Some they get typically breaks on having to file taxes in a lot of cases. They get Section A housing, subsidized housing, where they basically don't pay very much for rent and it's subsidized by the government. They get things like food stamps. They get things like Medicaid. They kind of help with all different kinds of things, particularly health insurance. And like I said, whether you think it's a good thing, whether you think it's a bad thing, really does not matter. It's irrelevant. There's two sides of the argument. I'm not going to get into that today. But we acknowledge that these things exist, right? Essentially, folks, there are programs in the Medicare world that do the same thing, that provide people with benefits that they probably would not have gotten otherwise. And if they were going to get them, they would have to pay quite a bit of premium for them. We also have this in the Obamacare world, in the marketplace plan insurance world. People can qualify for subsidies and lower their premium sometimes 90% of what they were going to pay. So if they were going to pay $600 a month for a plan, they could probably get that plan for $60 if they have a subsidy in the marketplace world. In the Medicare world, it's not any different. And, who knows? You might have a friend, family member, loved one that is in a situation like this that could qualify for these benefits, and they might not even know about it. We've been doing some campaigns in my office where we've been basically sending out, mailers to bring awareness in my local area of these programs. And, you wouldn't believe how many people that fully qualify that don't even know that they exist, and it gives them probably 10 times more benefits than they would have had without it. We're, of course, talking about special needs plans. They work with people that have both Medicare and Medicaid. In the industry, we call those kind of individuals dual eligible people. People that are dually eligible for Medicare and as well as Medicaid at the same time. I've taken a quick break. Hear from this week's sponsor. Don't go anywhere. In segment 2, we'll be back, and I'll explain exactly how these work, what they give you, and what kind of ones exist. Welcome back, everybody. Thanks so much for sticking with me through that break. And let's talk about special needs programs. What are they? Who qualifies for them? Very simply, like I mentioned in segment 1, folks, they are available for people that are dual eligible, right? And also another thing we mention, we refer to them as in the industry as Medi plans, Medicare and Medicaid plans. And essentially, folks, what these plans are is there's two different types of special needs plans typically. We're going to be looking at plans that are called DSMP plans, and in the industry we call them DSNPs. They also have something called CSMP plans, short for CSNPs. SMP stands for Special Needs Plan. And essentially, folks, let's start with the Medicare-Medicaid side of things. If someone has Medicare and Medicaid at the same time, for those of you who don't know, Medicaid is assistance from your state. In some areas, they don't even call it Medicaid. For example, in California, they call it Medi-Cal. But basically, it's assistance from your state to help pay for premiums, co-pays, out-of-pocket, prescriptions, extra benefits. Sometimes they give you a little bit of dental vision hearing. And essentially what they do is they're going to basically pay for a person's Medicare Part B premium, so that way they don't have to pay for it any longer. In some cases, of course. Not all levels of Medicaid allow that. They're going to pay for a person's prescription costs. They're going to help pay the prescriptions along with the plan. They're going to pay what Medicare leaves behind, the 20%. Sounds pretty good, right? So why would you need anything additional? You have full medical coverage. What happens when you're on Medicare and Medicaid is if you're not already enrolled into a Part D prescription drug plan, they will randomly pick one and enroll you into it whether you like it or not. Typically, the premium is going to be paid for by Medicaid, and that's where you get your medications from. The Medicare Part D plan comes through and pays a portion of the medication. Medicaid will come through in the form of LIS and extra help and pay a lion's share of that copay. So if you have a medication that's normally a $40 copay, you could potentially get it for $2 or $3 by having Medicaid and a drug plan, because they're working together. They're coordinating benefits a little bit. Now, what these special needs plans are is the dual special needs plans are offered through private insurance companies. They're types of Medicare Advantage plans. And I always like to refer to them as Medicare Advantage plans on steroids in most cases. In some markets, people can get as much as $1,000 to $3,000 of free dental coverage just included into the plan. These plans get heavily subsidized by Medicare as well as Medicaid. And they work like most Medicare Advantage plans, as many of you know. When you have a Medicare Advantage plan or a Part C plan, same thing, two different names for the same thing, you're running your Medicare through a private insurance company. And this private insurance company takes over. They take over for Medicare. They're paying the bill. Now, Medicare doesn't have to pay 80% of a person's medical bills anymore. That takes a big burden off of Medicare's shoulders. In exchange, Medicare agrees to fund this insurance company every month to take care of you. So they get funding from that. But they also get additional funding from Medicaid and other sources, which allows them to provide benefits that you probably never would have been able to get otherwise. Henceforth, the tremendous dental benefits. A lot of times, there are some Medicare Advantage plans out there that give you $1,000 of dental, $1,500 of dental just included into your plan. But it's more common anyway that you'll see an Advantage plan give you preventative dental, maybe fillings, just little stuff. Doesn't mean they don't exist, but special needs plans will give you rich dental benefits. As rich as you're going to find anywhere, probably even richer than just buying the dental coverage by itself. They'll also give you an array of hearing coverage for hearing aids, exams. A lot of times they'll pay all of a hearing aid, or most of it. They'll give you a lot of glasses coverage. Basically, they give you transportation, meals on wheels, all different kinds of benefits. Whatever benefits you can expect a Medicare Advantage plan to have, they have probably 10 times more. And of course, the medical coverage typically doesn't work any different than it would with just original Medicare. A lot of times what you're looking at is you're going to pay nothing out of pocket for the medical bills. And so these plans have one downside, and like any Medicare Advantage plan, they do have networks of hospitals and doctors. As long as you find out that your doctors are in the network with that plan, it has no downside, and it's a no-brainer. Chronic special needs plans are a little different. They're designed for people that have certain kinds of medical conditions. They don't have to be on Medicaid. An example of one of these certain medical conditions might be type 1 diabetes or heart problems or things like that. They will come through and they'll give a person what's known as a CSNP plan, a CSMP plan, a chronic special needs plan that will typically pay for their medications 10 times better than any other Medicare Advantage plan would or Medicare Part D plan would. And on top of that, they'll give them better medical benefits as well. So two ends of the spectrum there. They're not available in every market, but if you think you might qualify for one of these programs, you need to check them out and see if they are available in your particular market. Don't go anywhere, folks. I have to take a break, hear from our sponsor one last time, and I'll give you my final thoughts in segment 3. Don't go anywhere. Welcome back, everybody. Thanks so much for sticking with me all the way to the end. Final thoughts on special needs programs. Well, essentially, it's this. There are more special needs plans, whether it be dual special needs plans or chronic special needs plans, that have become available across the country than ever before. There's more of them expanding into markets, even in my home market here in Utah. I'll use that as an example. Years ago, I could probably even reference as early as 2 or 3 years ago. There was only one company that had special needs plans in our market. Now there's 3. You're seeing them expand and, essentially get much, much more popular across the country. All you need to be looking for as far as special needs plans are concerned is that your doctors are covered, that you're getting the most benefits you can possibly get, and it's with a good company. Because there are some incredibly flaky, bottom feeder, pardon my French, companies that do kind of live and hover in the special needs world. And the difference between having a good company that gives you $2,000 a year of dental coverage and a bad company that gives you $3,000 a year of dental coverage, it's not worth it taking the extra $1,000 of dental coverage if you have to deal with a nightmare of a company every step of the way, and you're going to have to fight them to get them to pay out a cent of that dental coverage. Some of those companies do exist. So just wanted to make sure that you were wary of that. As always, folks, if you live in the states of Utah, Colorado, Idaho, Oregon, Washington, California, Texas, Virginia, South Carolina, Florida, again, that's Utah, Idaho, Colorado, Oregon, Washington, Florida, Texas, South Carolina, Virginia, or Florida. Did I say Florida twice? If I did. If you're in one of those 10 states and you'd like to talk with me personally about your Medicare plan, we partner with all of the largest insurance companies in the industry. My office number is 801-255-5340, 801-255-5340. The best part of it is we don't cost you a penny. It's the same price to get a plan through us as it would be directly through the insurance company. The difference is you save yourself hours and hours of research by cutting the learning curve and talking with someone that knows right off the bat what you need to be looking for. So anyway, folks, I'd love the opportunity to talk with you if you live in one of those 10 states. And until next time, thank you so much for taking the time. Thanks for listening. Thanks for being here with me. And we'll be back with you with another Dynamite episode on Saturday. Take care.